A warm welcome to this talk. Now, in a minute, we're going to be listening to Dr. Bhattacharya, who, of course, is the new director of the National Institutes of Health. And Secretary Robert Kennedy has asked him to look at the causes of autism. And he's also looking at data now from the mRNA vaccine technology. Now, he's getting access to all the data from the National Institutes of Health now that he's currently analysing. And that data hasn't been released in full yet, but it does confirm some of our worst fears about the dangers of the COVID vaccines. So he talks in this brief interview about the uptake for the COVID vaccines basically collapsing in the United States. Now, sadly, they're still being advised for some people in the United Kingdom for reasons I find somewhat strange, bemusing, whatever term you'd like. Dr. Bhattacharya, who's a doctor, is a physician, is a researcher, a very highly published medical academic. He said it was good that the childhood COVID vaccine uptake was low, despite the recommendations that were going around at the time. But basically, he says that COVID vaccines are dead now in the mind of the public, but, and there's a big but here, he's got now new data on the mRNA technology that, as I said, does confirm our worst fears. And let me give you three specific examples of what he talks about. First of all, he talks about the theory. Now, the theory, of course, is you have a small dose of an mRNA, it goes into your arm, it just stays exactly in your arm, doesn't it? It never goes anywhere else. That was always nonsense. And it produces an antigen, and your immune system produces response to that antigen. An antigen being anything the immune system recognizes as being foreign, and it will produce an antibody and a cellular immune response to. So that's the idea, that's the theory. All sounds really good. In fact, someone was given a Nobel Prize for that. But what's the reality? He talks about the reality, and the reality does confirm what I've been thinking for 3 years now, basically, and what senior doctors and scientists around the world have confirmed or said to me that they believe is true. That's now being confirmed by actual data. And the first one is the dose of the antigen. So when you give this certain amount of mRNA, and he says you can control that, the dose of mRNA that you give to some extent, you just said to some extent, but you can't control how much antigen that's produced. So in some persons it might produce a little bit, in others it might produce huge amounts, and in other people we know that spike protein is still around after very long periods of time. So you can't control the antigen. You know, this just goes against the axioms of healthcare. You give the right dose of the right drug to the right patient at the right route at the right time. You know, you give the right dose, but we don't know what the dose is. It's a random dose. The dose can't be controlled. How can regulatory bodies still be approving this if they can't control the dose of the antigen that the mRNA vaccine gives the body? Next point, biodistribution that he talks about. No control over biodistribution. Now, if it's given via an inadvertent intravascular injection, that's particularly bad. But these lipid nanoparticles are so small, even if you give it the best intramuscular injection technique in the world, which, to be fair, is not done very often, but it still goes everywhere. Everywhere, meaning your brain, meaning your thyroid gland, meaning your eyes, meaning your heart, meaning your liver. And the anatomy here is well known. I've taught it for a few generations now. You know, something goes into the arm, that's into the systemic circulation, goes into the heart, the left side of the heart pumps that to the entire body. It just goes everywhere, systemic distribution. And that's, Dr. Bhattacharya says, that's why there's harms, and he used that word harms, in many body systems. So there can be adverse reactions in many body systems because of the systemic distribution. So can't control the dose, can't control the biodistribution. Third point, antigen is not fully predictable. So this mRNA code, you can get what you call frame shifting. You can actually like jump a code letter. So you can get different proteins produced other than the exact antigen that you were trying to produce in the first place. So the dose is not predictable, the biodistribution is not predictable, and the antigen molecular architecture is not completely predictable either. And one thing that really concerns me, and we haven't heard much data on this, but I'm really concerned that these frame-shifted proteins that the mRNA code makes anywhere in the body I'm really concerned that that could produce a prion. Now, a prion is a proteinaceous infectious particle. For example, you might have heard of it with Creutzfeldt-Jakob disease and bovine spongiform encephalopathy, so-called mad cow disease. And what happens in prion disease, it's a proteinaceous infectious particle. So it's not a virus, it's not a bacteria. The protein actually changes the shape of other proteins that it comes in contact with, and you kind of have this cascade effect. So I'm really concerned that an antigen is produced, which is not the one that we wanted to produce, but has actually got the potential to cascade and adversely affect other proteins. Now, I don't have evidence for that occurring, but I certainly think we should stop these vaccines until there's evidence that that is not occurring. So Dr. Bhattacharya says we can't control the dose, we can't control the biodistribution, we can't control the exact nature of the antigen that's produced. And he points out with some irony that there was a Nobel Prize awarded for this work, but it's going to take a couple more Nobel Prizes before it's ready for public uptake. So let's listen to Dr. Bhattacharya now. It only lasts for 3 minutes, but good to see the Director of Health now seems to be pretty switched on. Bad that the data he's reading seems to be confirming the fears we've had for some time. Let's listen to him now.
The COVID vaccines themselves, if you look at the actual uptake around the world, certainly in the United States, it's collapsed, Andrew. I don't think we takes that much more in the sense that very, 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 very few people are still taking these things. And certainly children, the uptake was never very, very high, which is actually really quite a good thing, at least in the United States. So I think that in that sense, the mRNA vaccines for COVID are already in the minds of the public, in the marketplace, effectively dead. The money that Pfizer is getting from them, the money that Moderna is getting from them has collapsed from the astronomical levels they got in 2021. To me, the next step is the mRNA platform itself. So I've been looking very carefully at the data that have started to come out on so the theory, like I'm just going to tell you what the theory is versus the reality. The theory is that I give you this mRNA code, your body, your cells produce the antigen that I, the scientist, wanted to produce. Your immune system reacts to it and then trains it to react to that antigen, which is similar to the COVID virus antigen, right? And that's the theory of the protection. The reality is that the dose of the antigen that's produced, that you're induced by one mRNA strand, it could be 1, 2, 3, 5. There's no control over it. The dose of the antigen, the dose of the mRNA, you may have some control over, but the dose of the antigen, almost none, because you don't have control over how many copies are made of the antigen per string. The biodistribution of it also is not controllable, right? So you see evidence of harms in lots of different body systems because but one reason might be because the biodistribution of where these antigens are made is not controllable. And the third thing is that the fidelity of the proteins made by the code for the mRNA technology is not perfect. You often get antigens and proteins that are not in the code itself because there's skipping, frame shifts, and other things. And so from a regulatory perspective, how as a regulator do you say, okay, you can give this product to people even though you don't know the dose that you're giving to people, even though you don't know where it's going in the body, and even though you don't know that you're producing the target antigen that you want to produce, right? And so, as a future platform, okay, there was a Nobel Prize awarded for the mRNA technology to begin with that allowed it so that it would actually produce the antigens without your body sort of overreacting and with this immune overreaction and destroying it or just getting rid of it. There's going to need to be 2 or 3 more Nobel Prize winning advances before this is ready for prime time, I think. So that's the next step is making sure that regulators understand that when they improve products with this mRNA platform, they're approving platforms where the manufacturer has no idea what the dose they're giving, no idea where it goes in the body, and whether the antigen itself that they're supposedly producing is actually produced and not just off target, and also not off target antigens as well.
Well, there we have it. That sounds, they summarised it really quite nicely. The onus is now on these independent regulators around the world to say why they're happy to authorise products that the dose can't be controlled, authorise products where the biodistribution can't be controlled, and authorise products where the actual shape of the molecule that's being given cannot be controlled. And we are a long way away from safe mRNA technology. Now, it's an interesting technology. It's got potential in the future. But we are 2 or 3 Nobel Prizes away from being able to use this safely in medicine around the world, according to Jay Bhattacharya's thinking, which I, of course, completely agree with. And yet, factories are being built there's factories operating and still being developed in Australia, in England, in Canada, all around the world to push this technology. So maybe manufacturers had better suspend that huge investment, because if it's unsafe technology, if we need another 2 or 3 Nobel Prizes before this is usable, maybe they better wait for another 2 or 3 Nobel Prizes before they roll it out. My concern, of course, is they won't stop. But for now, as always, thank you for watching.